Hello everyone, welcome to my YouTube channel Dr. Akif Baig. Today we will be talking about Bendopnea. So as we all know, what is orthopnea and what is trepopnea, and there is one more entity called as platypnea. Orthopnea means patient will feel breathless on lying in supine position. So when the patient is in horizontal position, the patient will get breathless, and that's why he prefers to lie down in a sitting position. So as you can see here, so patient is in sitting position with bending forward here. So breathlessness on lying in supine position is called as orthopnea. Breathlessness in sitting posture, if the breathlessness is there in the sitting posture, then it is called as platypnea. And if the breathlessness is there in lying on one side, so on one lateral position patient feel breathlessness, then it is called as trepopnea. So bendopnea is a newly described symptom which is of normally of heart failure. It means shortness of breath when leaning forward. So whenever a patient bends forward, like bending over to tie a shoe or putting socks, as you can see here, whenever the patient bend forward to tie shoes or for tie shoes, then if he stays like that for 30 seconds, so what happens is there, if the patient is normal, healthy patient, there will not be any breathlessness and all. But if a patient has underlying left ventricular failure, what will happen is bending like this will lead to increased intra-abdominal compression. So bending of this because causes the more compression of this intra-abdominal space, which will lead to more splanchnic blood vessel. This splanchnic blood vessel will lead to compression of more splanchnic blood vessels. It will cause more increased venous return. So if you bend forward in this patient, more compression of the splanchnic vasculature, it will lead to what happens is more blood will reach to the heart, increase venous return to the heart, and it will lead to increased pulmonary edema if there is a left ventricular failure. So because that much of volume will not be tolerable by this heart. So heart in case of LV dysfunction, left ventricular dysfunction. If there is no LV dysfunction, patient will be able to tolerate this quite well. So this is what is called as bendopnea. It is a sign of underlying heart failure. Thank you.